Joining us this morning, our friends from Titusville Area Hospital, and Kelly Clark joins us, Marketing and Communications Specialist. Hi, Kelly. How are you?
Hi, Luke. I'm good. How are you doing?
Good. Always busy. Always something going on.
Definitely.
We have a lot to get into here this morning because there's a lot going on this week. There's a lot going on at the hospital, and you brought in a special guest, somebody we haven't seen in a little while, and it'll be nice to catch up with her.
I did. So November is Home Care and Hospice Month. So today I brought with me Dani Schmidt. She is the Billing and Marketing Specialist for Hospice of Crawford County. So one of her jobs is to do a community outreach for her agency. So this was a good time to bring her in.
Yeah, Dani, good morning. Good to see you again.
Good morning. Glad to be here.
So how much has changed in this COVID era that we're in?
Oh, you know, hospice is a unique business, but the nice thing is the care is always the same. So what we're seeing is actually an increase in utilization of hospice services, which we are proud of when people are trying to make sure that they can care for their loved one at the end of life. So a lot more people are keeping their loved one home versus using facilities or additional resources. So we're busier than ever.
Are people surprised to know that that's an option?
I think they're surprised to know that there is that much support out there and how they can utilize that. So I think, well, people are aware of hospice as an option of end-of-life care. I think the fact that they can do it at home with a lot of support is new and exciting for them.
Kind of backtrack a little bit and update us and maybe catch us up to date, I guess, with hospice and just the organization in general.
Sure. Hospice of Crawford County is fully owned by Meva Medical Center and Titusville Area Hospital, so we're a subsidiary of both hospitals. And a lot of people think all hospices are the same. When they hear hospice, they think that, oh, well, if I choose one or the other. But hospice is a business as well as a healthcare agency. So we are the only locally owned hospice, being owned by the hospitals, and we are the only nonprofit that services this area. So that's extremely important. And while it's a level of care for end of life, you have to qualify for it, and that is what is standard across all hospices. But when you hear the word hospice, you want to think your local choice, which is Hospice of Crawford County.
And how does a family go about using the services that you guys offer?
We can take referrals from any source. So physician, families can call in. Other agencies, sometimes it's home care agencies, sometimes it's outlying hospitals or other agencies. We do go by geographic area, so we can service 60 miles from both of our offices. So a 60-mile radius from a Meadville office and a 60-mile radius from the Titusville office. So that covers quite a bit of area. We actually touch at least 5 counties that we can service. But generally, a person has to qualify by having a terminal diagnosis and a life expectancy of less than 6 months. And all that means is that 2 physicians review their care and say, yes, I would expect that if this normal trajectory of this disease takes its course, that this person would not be here in 6 months. If that time passes and the person has not ceased to exist with us, then all they have to do is say, yes, we still continue to think that this is what would happen. So you can call the agency. Here in Titusville, it's 814-827-0330. An intake person will take your call. We do some medical records advice giving, and we have to collect some data. Get that reviewed by our medical director here in Titusville. It's Dr. Brian Lose. One of the things we're very proud of is we have the only hospice and palliative certified medical directors, both in Titusville and in Meadville, and that's unique for us. So that gives those patients an extra layer of support, an extra layer of expertise from the medical director. Sometimes folks ask us, but what if I want to keep my own physician? You are more than welcome to keep your own physician throughout your entire course, but you still have the access to these specialty trained physicians who may utilize medications a little differently or have input on your plan of care that your doctor would then approve.
We always talk about the special kinds of people that work for hospice, but during the pandemic, boy, we've really seen how just the healthcare profession is just filled with amazing people. Has that been? We know that relationships develop when working so closely with families. Has the pandemic changed that at all? That relationship or how your staff works with families?
I think we are extremely interwoven with the families at this point. They lean so heavily on us for nursing care, for our aid services, for bathing and dressing, for our chaplain, for our social workers to just meet all those needs. And one of the great things about hospice, whether it's Hospice of Crawford County or any other agencies, we're required to continue that support even after your loved one passes. So in our agency with Hospice of Crawford County, for up to 18 months, we will keep in contact with you. We will come and visit. We'll send you letters and notifications. You have access to bereavement services. So those things are always extended. But I would say in this time, we're even more closely knit. You do feel a special bond with somebody when you're going through all of this together.
Being associated with the hospitals, are there still opportunities to support hospice? If maybe a family's used the services before, can they give money? How do they help support hospice and the mission that you guys have?
Absolutely. This year has been so challenging because we haven't been able to do our general busy fundraisers that we do. Our golf outing got canceled. We typically have our Bluegrass Festival in January. We're looking at that's probably not going to be able to happen as well with the state of everything. So we are always accepting donations. You can mail them either to the Titusville office, which is 417 North Monroe Street, or generally I work between both offices. Our main office is in Meadville at 766 Liberty. We do have our Marquette Hospice House. However, we don't receive mail there. So if somebody asks to do a donation directly to that, it has to flow through one of the offices. We can take check, we can take cash. We do take credit card, and usually we have to get some data on that for people when they call in. So calling either 814-827-0330 or 814-333-5403, and one of us in the office can help with that. Our business hours are 8 to 4:30, but we have on-call nursing all the time. So.
Kelly, for the hospital, it's got to be great to have hospice as part of the organization.
Oh, definitely. Yeah, so being part of, Meadville and sharing in that service, is really helpful because it can cover all of the areas that, that they touch on. Like she said, it's 60 miles outside of their offices. So, a lot of our rural areas are included in that.
Yeah, when you pull that map out and you look, you go, oh, wow, that hits a lot of a lot of area here.
Right.
Okay, we'll come back to Dani in the conversation about hospice. Let's catch up with some other things going on with the hospital.
Yes. So this week is Antibiotic Awareness Week. So it basically just focuses on antibiotic safety, different things, about the antibiotics that could be dangerous, how they're helpful. We are doing some Facebook posts and also posting flyers in all of our offices. You can also visit the CDC website. They have a lot of great information about this week, about antibiotic safety. So if you go on the CDC website, there's a link to go to the antibiotic safety.
Here's a note here that kind of stands out for me. Antibiotics do not work on viruses.
Correct.
Okay.
Correct. Yes, they work on bacterial infections. And really your doctor, has all of the same information. So they are also a good source of information, is talking to your primary care physician about, what antibiotics help, what they don't help. There's certain bacteria that are already resistant to the antibiotics. So, just talking to your primary care physician is really helpful.
Okay. Also, dental care. This is something that's been exciting to announce.
Yes, very exciting. So we've been working on it for a long time. So Dr. Rockwell, you got to meet him. He was actually on with us. So he's seeing patients on Mondays in the dental clinic, which is in the Rural Health Center, in physician services, right on the first floor of the hospital. And they are starting to take appointments. They're already underway. Like I said, we are only open on Mondays, so some appointments, might be pushed out a little bit, but definitely call, get your appointment scheduled. They are treating children, which is really the main reason of why we started the dental clinic, was to get some kiddos that didn't have care and get them started with a dentist. They're accepting CHIP and medical assistance insurance. So that's really helpful because in the past that's not been a service that's available in the area.
Well, also the fact, working with kids, sometimes you don't see that excitement to announce that hey, kids can come here.
Right.
Dr. Rockwell was very excited to say, yes, kids, adults,
Yep.
everybody.
Yes.
Okay. And then we also met Dr. Rubin.
Yes. So she has started seeing patients as well. She is our gynecologist. at the hospital. She's also in the rural health clinic in the physician services suite on the first floor. Yes, and since she's just getting started and building up her patient base, same day appointments are often available. You can call the office. It's the 827-9770 number and get an appointment. So we're very, very excited to have her. She's really filling a gap because what we have found was that a female gynecologist was expressed as a need in the area. So we're happy to be able to provide that now.
That's awesome. That's great. And great people. Dani, back to hospice. Does it excite you to know that these hospitals are continuing to invest in their community, and it's not like, okay, we're just going to sit back and watch the world go by. We're going to go after great doctors. We're going to go after great equipment and medical treatment. I mean, that's got to be kind of a nice thing to be part of that.
It's so exciting because you never know where hospice is going to be needed. We treat children through, very aged. So to know that there's all specialties that may or may not need contact with hospice, but also to know that the health system as a whole invests in the whole gamut of health. There's no area that we're leaving untouched.
What's next for you going into 2021? What sort of things are you guys working on?
This pandemic has changed so much. One of the things that I've been waiting to do is to start a volunteer class. But until we can gather or find out a different option, we're trying to figure out how to handle that. But one of the things I really am passionate about is building up our volunteer base here in Titusville. So stay tuned for that.
Okay.
The other thing we're trying to do is try to figure out some sort of virtual memorial service. We twice a year hold a memorial service for anybody that's been touched by our service, and without being able to gather, that's been a little unusual. So I've been charged with the task to figure out whether we're going to do a drive-through type of service or a Zoom type of service, but to try to somehow put together a memorial service for those that we have lost in the last year. So while things have changed, we still are trying to stay true to our mission, which is to give that care from the end of through the end of life and beyond.
Yeah, and you hear a lot about that. Families not being able to see family members, if they pass, not being able to go to a funeral and recognize somebody properly or saying goodbye, those final goodbyes. So it's great that those things are in your thoughts as you guys work into the new year. Hard to believe we're going into a new year, isn't it?
I know. This marks my 5th year with Hospice of Crawford County, and I believe it makes our 37th or 38th year in service. So we're thrilled to be part of this community.
That's great. Congratulations on that. And again, folks just have a real passion, and it's not the easiest job in the world, but their hearts are incredible.
Yeah, and we're so proud to have local nurses caring for our local people. Every one of our nurses from the Titusville region lives in this region, and the Meadville region. I think all of our folks live in Crawford County or one of the neighboring counties very close to the border. So we are local people caring for our local community.
Yeah, and that makes it tough too when you know somebody.
Or comforting. It does also make comfort knowing that you have somebody who's going to care for you pretty much as a community member, almost as a loved one.
Yeah, real heroes, and we can talk more about that in a second. You're watching The Morning Drill on Stream Television and on Armstrong's Neighborhood Channel, and listening to it on the Allegheny News Talk Sports Network. Usually, Holly will stare at me, Kelly, when I ask her about the emergency room. But there's been a lot of excitement with that. So what's been going on with the emergency room?
Right. Yes. So the emergency department renovation that's been ongoing, we are very, very excited to be in the final phase, which because we talk about it every time we're on here. But
I have been trying to be quiet about it, but there's been a lot of excitement.
There is.
And pictures, Dani, pictures.
Yes, so it will be complete, we hope, by the end of this year. Okay. They're currently working on the outside of the emergency department where the original emergency entrance was. They're fixing the canopy, the ambulance bay. They're redoing that so patients can get in there a lot easier. Ambulance have an easier route to get in there. So that's really exciting. However, we do have the main entrance, the front entrance of the hospital is now the emergency department. So if you're headed that way, just be aware. There's lots of signs up. There's emergency parking available right at the front entrance. So
okay.
Hopefully it'll be a short phase.
What's next as we go into December and wrap up the year?
December, yes. Yes, so very exciting. I mean, a lot of things were canceled this year. We usually have our Christmas party, so we weren't able to have that. But they are still doing the Lights of Love for the auxiliary. They are just starting to launch that, so there's not a ton of information out there yet, but probably next month when we come on, we'll have some more information about that from the auxiliary.
Great, and good job. You guys have put in a lot of time and effort, and the whole industry. Congratulations on just everything that you guys do.
Yes,
So,
thank you.
Dani, real quick, just update us again on how folks can contact you before we wrap things up here.
If you need to reach Hospice of Crawford County, please give us a call at 814-827-0330. If nobody answers that line, it kicks over to Meadville, so you should get a live person, 8 to 4:30. And after hours, we have on-call nursing who does respond to any calls after hours. So we're available 24/7.
Good to see you. Great catching up. Please come back.
Thanks for having me.
All right, you guys do fantastic work. And again, Kelly, a lot of things going on. Antibiotic Awareness Week is going on.
It's going on.
It's happening.
It's happening right now.
Okay. So check out the flyers. You'll see those around. Dental clinic is open, and Dr. Rubin also taking new patients.
Yes, and they're both the same phone number, the 827-9770.
Great. Good to see you guys. Thank you.
Good to see you.
Thank you.
Thanks,
care.
Luke.